Aspirin could extend the lives of nearly 1 million Americans if these people would just start taking it every day. This, according to a new University of Southern California study led by CBS News contributor Dr. David Agus. For more on exactly what it all means, I am joined by the good doctor from Los Angeles. And David, again, this study found that aspirin really has a potential to make a tremendous impact on our health, also our wallets. What'd you find?
So it's pretty amazing, right? This 2,000-year-old drug, right? Hippocrates said you take the bark of the willow tree and chew it, pain and fever go away. That's where aspirin was originally described. But if you take this pill every day, about a 30% reduction in cancer death rate, 22% in heart disease, 17% in stroke. And so we did a simulation study on a computer saying that if everybody who should take it by the guidelines, by the year 2036, an extra 900,000 people will be in the U.S. population, and the net health benefits is $692 billion. Those are big numbers.
Mm-hmm. And not to ask you to be overly simple, but how come?
Well, we think that aspirin has an anti-inflammatory benefit. So by taking a low dose of an anti-inflammatory every day, you temper down these diseases. And these are randomized studies done over decades in literally hundreds of thousands of people. So the data are real. There are side effects, right? It upsets your stomach and it can prolong bleeding. So it's something you want to discuss with your doctor first, but for several dollars a year, the net health benefit here is pretty dramatic.
Why hasn't there been a bigger push then to this point?
Well, I think the preventive guidelines are there, right? Doctors know it, and we should be doing it. The problem is it's too cheap. When something is this cheap, nobody's going to market it, and people don't perceive value in it. So we need to change our psychology around it, because certainly we as a society have to practice prevention if we want to do health reform.
Who should be reaching for the bottle then?
So clearly, people over the age of 50 who have any risk factors for heart disease or cancer should be taking a baby aspirin a day, or I should say better, should be talking to their doctor about taking a baby aspirin a day. And that's 81 milligrams, the smaller size.